Hello, lovely woman, and welcome back. You are watching Straight from the Doctor's Desk with me, Dr. Andrea Purcell. I specialize in menopause medicine and help women struggling with health and hormonal issues reclaim and regain their life using natural medicine. This is so you can stop surviving, start thriving, and get back to that health and that life that you love and want to enjoy. So today's topic is all about the symptoms of menopause. Maybe you've turned 45 and you feel like your body patterns are starting to change. Maybe things are really going downhill fast for you and you're starting to feel out of control, energy tanked out, not sleeping well, your weight is up, you're not alone. I was just talking to a longtime girlfriend of mine just a few days ago, and she's about 5 years younger than I am. And she said that she was having trouble sleeping for the last 3 to 4 years. And she was just dealing with it in silence, not realizing that it was a sign of perimenopause. You know, it's almost like you just wake up and you push through and you keep going. And it just got me thinking about you and what you might be going through, thinking that you can just ignore the symptoms, or maybe they're going to go away on their own, just hopefully. And so I just want to run through a few symptoms of menopause that can dramatically affect a woman's quality of life. So maybe you can start putting the pieces together for yourself in your own life. So hot flashes tend to be an obvious symptom, ranging from hot to warm, mostly face, chest, and back. They cause reddening of the skin, profuse sweat. Night sweats are hot flashes that happen during the night, and they can cause a woman to wake up sweaty, throw the covers off, only to be freezing 15 minutes later and then put the covers back on. Mood issues, feelings of anxiety, depression can set in. There are brain effects like the mood swings, but just forgetfulness. Brain fog is very common. Estrogen increases blood flow to the brain. So when estrogen levels drop off, the brain no longer has that increased circulation. And when we feel these symptoms, they can be unsettling. And many women have asked me, hey, does this mean that I'm getting early dementia? And the answer is no. However, being proactive with our health, including our brain health, is very important as we move into this life stage. There are also cardiovascular symptoms that develop. Elevations in heart rate, heart palpitations, racing heart are very common. They can lead to panic attacks. And some women even develop high blood pressure. And then there are all these concerns that develop around weight gain, urinary incontinence, fatigue, aching joints, vaginal dryness, and thyroid issues. And here's the thing. If you only use conventional medicine, you would need to go to no less than 5 specialists just to address all of these concerns. And you don't have enough time in your schedule to go to all these doctors. And plus, you really want to get put on 5 or more prescription medications at age 50 that you're going to take for the rest of your life, all because you're in menopause? No, you don't. Because common medications used to address menopausal symptoms are really off-label uses of medications used to treat other things. They can include antidepressants, anti-anxiety medications, birth control, sleep medications or hypnotics, anti-epileptic medications, blood pressure medications, and then of course hormone replacement. And all of this is being pieced together for a woman. And that's really why I love natural medicine for women in menopause. Because in the world of natural medicine, we treat all of you, the whole picture, all of you. And you won't need to go to 5 different doctors and try to piece together the information that they give you. And trust me, with that disjointed system, there isn't any way to get a cohesive plan in place for yourself. Now, sometimes, even in natural medicine, we do need to get a specialist on board, say an endocrinologist or a gastroenterologist, but then we incorporate those findings back into your plan so you know what you're doing and why. Because really, menopause is not just about hormone shifting. It's about how hormones affect all the different organ systems. It's about supporting your body through the change, working with your body, not suppressing your body. giving you a firm foundation to stand on for the next 50 years. It's about preventing the most common chronic conditions that tend to set in during this phase of life and preventing them. And we can do all of that within natural medicine. Bioidentical hormone replacement therapy is helpful. However, not every woman is a candidate for hormone replacement therapy. So in natural medicine, along with dietary recommendations, lifestyle changes, bioidentical hormones, there are herbs, there are supplements, there are homeopathic remedies, there's exercise, self-care practices to put in place that help balance you. So giving you back that fulfilling life so that you can live more and worry less. So here in our office, we build treatment plans specifically for you based on what your labs say, what your lifestyle dictates, what your stresses are. And our patients find that they have more energy, they sleep better, they get their confidence, their motivation back, they just get out of pain. And you can too. So if you like this post, check me out on the web at www.drandreapurcell.com. Thanks for joining me today, and I am wishing you well.